Hello everyone. I am Dr. Berkkkaratas. The medicines used for erectile dysfunction and the medicines used for premature ejaculation are different from each other. Sometimes, of course, it can be like this. Ejaculation may occur earlier in people with erectile dysfunction. We've talked about this before. It was a vicious circle. In other words, there is such a rotating cycle towards erectile dysfunction, premature ejaculation, erectile dysfunction, and sexual reluctance. If a person has erectile dysfunction and says that I started to ejaculate earlier, yes, when he takes erectile dysfunction medication, when his erection improves, he returns to his old state and no longer ejaculates prematurely. But we cannot say that the drugs used in this erectile dysfunction are good for premature ejaculation. If a person has a normal erection and premature ejaculation, he must use only premature ejaculation medication. This has become quite a complicated situation. Because sometimes I say, have you ever used medication, especially in patients who divorce prematurely? Yes, he says I used it, but the drug he says is an erection drug and does not bring me any benefit. Of course, erectile dysfunction medication will not bring you any benefit, because you haven't used a real premature ejaculation remedy. Now, I can't give the names of the drugs related to it, but the active ingredients are the same all over the world. There are market names. There are a lot of trade names. Any of them can be used. Look, let me do something right away. Those ending in "-phil" and ending in "-phil" are used for erectile dysfunction. Tadalafil, sildenafil, verdinafil, avanafil go like this. And look at the one that ends with -tin, they all end with -tin. Let's just say the one that ends in "in". The groups difoxide, fluoxetine, peroxidine, sertraline are also often used for premature ejaculation. Lidocaine and the thing are the ones that are already creams. It can be lidocaine, pyrrolocaine drink, it can be cream, it can be a spray. These are already used not only for erection, but also for premature ejaculation. This is usually distinguishable, but there may be a problem with medications. For example, the person takes tadalafil to ejaculate prematurely. Does it help? Don't. In fact, technically, it may be beneficial for him. It could be like this. What happens to some people because erectile dysfunction drugs can provide the second and third more easily after the first intercourse? In the first relationship, he ejaculates prematurely again. In 2, 3 later, he is happy. Then he says my ejaculation problem is gone. But in fact, the problem does not go away. It only serves to increase the number of relationships. Also, as I mentioned before, if there is an erectile dysfunction, if there is a premature ejaculation that starts later, it goes away when the erection has passed. But our real premature ejaculation drugs they have groups that can be used before intercourse. There are groups that are taken 2 to 3 hours before. They are used regularly. Please do not confuse both groups of drugs. Let's go to the doctor, start using the drug that suits you, at the appropriate dose for your situation and with the advice of the doctor. Thank you.